Hi everyone, welcome back to our VHS classes. So today we are going to continue our unit 4 and we will continue our part, that is development of adolescence. So in this we will learn about the various stages in adolescence. So adolescent stage starts from 12 to 18 years. So let's first of all we will discuss about what are the various developmental tasks during this period. So first one is bodily control. During this time, both males and females reaches their puberty stage. So a lot of bodily changes are there. In girls, menstruation occur. In boys, beards start to grow. His voice becomes heavy. So these kind of bodily change we seen both in males and females. Next one is external interest and activity. During this time, adolescents develop a lot of interest and involved in some kind of learning skills so that they can express their interest and they can improve themselves and they can devote their energies in some or other way. Next one is peer identification. During adolescence time, peers want that get acceptance from others as well, and especially from the opposite sex. They want to be identified and get more importance from their own peers. That is peer identification. Next one is self-reorganization. Here in self-reorganization, a peer is interact with his parents, with his family, right, with his neighbors, with his peer group, with his friends. So when a peer is interacting and communicating with more and more social environment, her his and her personality goes in reorganization. Uski jo personality hai that reorganizes, that restructures, because they communicate and interact with their social environment. So that leads to personality restructuring. Uske jo thoughts hai, attitudes hai, they will start changing. Sometimes they will change in a positive way, sometimes they change in a negative way. Next one is social sensitivity. So during social sensitivity, our adolescents tries to learn how they can control their bodily pressures, how they can control their sexual urges, and they also learn how to understand others' peace as well, and how to get acceptance from others. That is social sensitivity. Last one is growth of self-control. During this time, adolescents is very actively involved in communication with their social environment. During this time, they manage their sexual desires well, emotions, particularly their attitudes, anger, temperament, and so on. So that is growth of one's self-control. Next one is cognitive thinking. During this time, when the adolescence reaches its age, so this time they are able to think in the form of abstract thinking. ऐसा नहीं है कि they are only able to think in terms of objective. The objective is present, then they only able to think. They can also think logically. They can also think rationally. They can also think practically. They can also think reflectively. मतलब वो हर तरीके से logical way से सोचने के लिए capable हो जाता है. That is cognitive development. Next one is emotional development. So when adults during this stage, adolescence is highly in emotional sensitivity. Every emotions feels them very deep and intense. They feel every emotion in a deep and intense form. Next one is ambivalent feeling. During this time, adolescents have mixed or contradictory feeling. So they need independence as well as they need social support. One side they need independence, they want to do the task by themselves, but on the other side they also seek some kind of support from their parents as well. Transference of affection. During this time, there is transfer of affection from parents to peers. Right? They will more attracted towards opposite sex. That is transference of affection. Next one is daydreaming and hostility. So during this time, adolescents use a very common defense mechanism, that is daydreaming. So they indulge in this activity because they want to get rid of their anxiousness, their anxiety, stress. So this is a kind of defense mechanism, right? So that's why they're involved in daydreaming. Fantasies are very common. Adolescents do some fantasies so that they through fantasies they express their desires. They express their desires and control their frustration and anger. Fantasies are also one or the same way used as a defense mechanism through which they express their social desires. So social development, they will able to form a good family relationships, good peer relationships. So in moral development, there is two things, that is post conventional level. During this level, we are in the stage of legalistic orientation, and second one is ethical principle orientation. So what happened in legalistic orientation? So here you can like learn from this thing. Legalistic means laws. During this time, adolescents start believing that the laws is for like good for the community and made for the improvement of the community. They start giving respect to these rules and regulations. Next one is principle of orientation. In principle of orientation, they like guide their behavior on the basis of conscience. Sometimes they feel that these laws are not able to do justice, equality, and is equally right for everyone. So that times they use their own conscience in order to decide whether these laws are good or not. So रिस्पेक्ट फॉर ह्यूमन डिग्निटी गाइडेड बाय देयर कंसाइंस, वो अपनी वैल्यूज के हिसाब से ही अपने बिहेवियर को गाइड करते हैं. So next one is, what are the psychological needs of adolescents? Most important question. Every time it is asked in your exams in 5 marks. So during this time, they need identity. They want to develop their separate identity. They want independence. Right? They need emotional support and understanding. During the time of adolescence period, like we have talked about, okay, this is a period of ambivert. They need independence as well. They seek support as well. So during this time, ये दोनों ही चीजें that is required by the adolescents. Next, that is peer acceptance. So this is very, very important. During the time of adolescence majorly want कि other age mates या other peers accept them. Need for recognition and status. They also want recognition and status in the society. Need for achievement. During this time, they are in the peak of their careers. So they want to achieve something. In order to achieve something, they need some guidance and role models so that they can reach their goals. Need for moral and value clarification. See, as we have done in moral development, some behaviors are guided by legalistic orientation, some behaviors are guided by conscience. So they need this kind of guidance and moral value clarification, how to deal with it. Need for sexual awareness and education. Sometimes during this particularly age, hormones are at its peak, and basically sexual hormones are releasing at its peak. So during this time, it is very, very important. With that, we should guide and educate adolescents regarding sex. What is protected sex, and what are the needs which they need to know before indulging in any kind of sexual activity. Need for self-expression and creativity. Last, we have like done कि fantasies are commonly used by the adolescents. So fantasies क्या करती हैं? When adolescents is using fantasies, so they are exploring themselves, they are expressing their desires, what they want to become. So that is need for self-expression and creativity. So next we will do adult 18 to 60 years. So this is the longest part of life. So during their 20s, most people reach their strength, agility, reaction time and manual dexterity. मतलब performing the skills with full perfection. So the word adult comes from a Latin word that means growth to full size. जब आप पूरे fuller size तक grow कर जाते हो, that is known as adult. So the adult so this stage is divided into 2 parts, early adulthood and middle adulthood. Early adulthood is from 18 years to 45 years and middle adulthood is 45 years to 60 years. So during this time, there are certain developmental and very important tasks which are like early adulthood has to perform before reaching in late adulthood. First of all, they have to achieve independence and responsibility. They have to like set their career so that they can achieve independence and are capable of taking any kind of house responsibility, spouse responsibility in any form. Establishing the home. Sometimes adulthood like build home with their parents. Sometimes they have to build their home away from their parents or with their spouse, depending upon their work situations. Next one is during this time, like early adulthood have to like choose their mate, right? So they have to do certain kind of marital adjustments with their spouse. Next one is adjustment to parenthood, as they are very new to this like parenthood period, so they need a lot of adjustments to become parents. Enhancing self realization. So during this time, they enhance ki what are the like various stable things through which they can like make their life stable. So lastly, they will set the patterns of life, ki how to like live a life, what are the things, values, like whatever everyone like live their life on their own values. Same as early adulthood also set patterns for their life. So let's see what are the how development take place during adulthood. It is divided into three parts: componential, experimental, and contextual. So componential, here it means कि कैसे we have in this particular intelligence. So it tells the people how they can reach and solve the problems. Next one is experimental, insightful. Here insightful means sudden recognition of problems. So कैसे the way we are solving the new problems by utilizing our old information, that is known as experimental. So these allows people to compare new information with the already known information so that they can came up with the new ideas. Basically this kind of task is like used in order to solve novel problems. Novel problems are new problems जो कि पहले उन्होंने कभी भी solve नहीं की होती, but they solve these kinds of problem with their previous information. Last one is practical. So how they can like adapt to the environment, how they can change it, how they can modify it, how they can make that environment comfortable so that they can particularly live in it. So that is contextual, that is practical. Next one is occupational development. During this time, they have a clear ideas about their work, like in what kind of work they want to engage in. So they are able to decide about a particular occupational preference, like what they want to do, right? They are interested in it. What's their passion for it? Implementation of training and entry into the first job. So during this time they will see how they can like get into a certain kind of job, what are the various steps of getting into their first job, how they can become stable, right, in a particular field. Whatever field they are joining, they will start exploring the opportunities, how much stable is this particular field for the future. Next one is advancement within a field or on the job, how they can like have more and more expertise in the particular field in which they have taken up, right, for their consolidation and advancement in that particular field. So this is the occupational development. There is no need to like do any kind of like rote learning. So in occupational development we must know what type of occupational हमारा fit in कैसा है, for which particular occupation we are fit in, whether that particular occupation is stable or not, whether there is growth or not. If we want to grow in that particular career, what are the various skills which help us in order to improve? So that is occupational development. So now let's quickly see what are the adjustment problems during adulthood. Unemployment, divorce, physical abuse, substance abuse, and broken homes. So these problems are very like common during adulthood. The most dominating one is unemployment. So what happens nowadays, adolescents are not satisfied, the wages which are existing in the environment is not up to mark, right? So sometimes what happen, they don't want to like work on the existing wage rate, so it also led to certain kind of unemployment. Divorce, Rate of divorce is also like raising like something. Divorce rate are increasing day by day. What happens, they are not able to adjust with each other. Some kind of physical abuse can happen with male or female, it can happen with anyone. Sometimes adulthood in this particular age, they engage in some kind of substance abuse. Sometimes they take these substances in order to like elevate or help themselves to like they can like lower their stress levels, but ultimately they dig into the hole of substance abuse, ये abuse करने लगते हैं. And broken homes or separation with their partners are the another major problem during adulthood. Next one is psychological needs of adult. So first one is positive self-image. Positive self-image about oneself, increase self-respect, self-esteem, self-confidence in self into oneself. So that is positive self-image. When a adult have a positive self-image towards himself or herself, वो उसके confidence को, उसकी self-image को, उसकी communication को बहुत ज़्यादा motivate करता है. Self confidence is another factor. When an adult is like confident what are the like things they are doing, so like it leads to a greater heights. They have realistic perception towards their goals. They set their goals on the basis of realistic perception, not on like imaginary or fantasies basic. They set realistic goals in their life which are achievable, right? Next one is occupational growth. So they like choose those careers, they will like get into those fields in which they can see there is some kind of occupational growth and some promotion are there. Last one is achievement of goals. So now we will cover old age, that is 60 years and above. During this process, during this age, aging is like processed. Physical health start declining, right? So it represents the closing period in the lifespan. So this is a last stage of a lifespan development, right? During this time, individuals often look back on their lives on their past, what accomplishments they have done. Like they will achieve satisfaction from those tasks which they have done during their developmental task of old age. So adjusting to one's infirmity. So during this time, old age people start accepting and adapting to physical limitations. As the physical like declining starts, they will some of them fell in chronic illness. They are not able to do certain tasks independently. So this is a period of adjusting to one's infirmity. They like have to like adjust themselves to certain kind of discomforts. Next one is preparing for death. During this period, everybody knows that during the time of like old age, this is the like a stage where like life end. So they start preparing somewhere in their minds for their own deaths, developing a sense of satisfaction with their life. So whatever they have achieved in their life, that achievements give them us kind of satisfaction and happiness. Relationship with one's own spouse. So greatly influenced by if both the spouses have common interest, health and intellectual development, then the relationship is healthy. Relationship with offsprings. Researchers have found that women have a more good and fiction relationships with their like children rather than their men. So there is usually a friction more between women and their children than between men and their children. So as we all know that mother are more inclined towards their children. Next one is relationship with grandchildren. So grandchildren are a source of enjoyment, involvement when a like old age people is in a certain conflict and intention that like grandchildren help them to ease it. So grandfathers have fewer and more remote contacts. Next one is relationship with siblings. So siblings act as confidant. They share their family occasions, holidays, their recreational activities. They will also like take some decision making skills from their like grandparents. So that provides emotional supports in the time of illness. Now let's look at what are the various psychological needs of old age. So during the time of old age, so they need security and safety. They need security for their health, for their finances. They need safety because they are dependent, because they are suffering from certain kind of health illness. Love and belonging. So the old age stage and the infancy stage is more or less is similar to each other, because both the stages, they both are dependent on someone other for their needs. So as an infant need love and belongingness, same as old age people need love and belongingness from their family, from their grandchildren, from their wife, so that they can free from loneliness. Recognition and respect. So they need recognition for what they have done. They need dignity. They need self-worth. They need to be feel valued. Independence. So during the time of old age, there is some desires through which they can make like personal decisions and retain control over their day-to-day life. They need certain kind of independence. Next one is emotional support. Emotional support plays a very important role during the time of old age. So we must understand old age people, their needs, their affection, and more on. Engagement and activities. So we always make them busy in some kind of hobbies and social participations and meaningful roles, so that they can so they don't feel lonely and like avoid boredom and depression. Adjustment to changes. If we provide support and help to the old age people in coping up with the retirement, loss of spouse, declining health, and reduce social roles. So they need help in adjusting to these social changes. Last one is spiritual fulfillment. Many older adults seek peace of mind, faith, and purpose in later life. You usually have seen that many old age people you will found in spiritual places, so that they can make their own peace. Last one is psychology of vulnerable groups. So vulnerable groups are those groups which are more prone to certain kinds of stress. So let's understand psychology of women. Passive dependence. So a woman is dependent to firstly before marriage she is dependent on her family, and after marriage she is dependent on her husband. Females are like waves. Why females are compared to waves? Due to many hormonal changes, due to many fluctuations in their hormones, females are compared to waves. Tolerance and abuse. As we all know that women's inherited patience from their genes, they innate this thing, so they will tolerate certain kind of physical, sexual, verbal abuse. Fluctuation of mood. As we have already talked about, females are like waves, so due to fluctuation in their hormones there is fluctuation in their moods. So researchers have shown that women have more increased level of depression due to fluctuation of mood as compared to men. Next one is body image. Women are more concerned and think a lot about their body as compared to men. Women are more caring as compared to men. They show a very caring, affectionate towards others. So next one is psychological problems of women. First one is gender influence. So in the previous slide we have also covered females are like waves, so this is very much similar to this. As researchers have shown that the level of serotonin is less in females and more in males. So males have more stable moods as compared to men. Next one is social cultural influences. In a today's scenario, we have seen that women are working in every settle, and sometimes they are more stable and are more financially stable than the men. Still, they have to face a lot of stress issues, which could lead to depression, anxiety, or some kind of attacks. Next one is sexualization. So women are always seen as an object for sexualization. So women are also used as an object of sexualization, and people are using them for for their sexual desires. Violence and sexual abuse. Women are more prone to violence and sexual abuse. Assertiveness. In women, there is lack of assertiveness. Assertiveness here means that not able to tell someone what they really want or they want to do. Next one is maternal psychology. In maternal psychology, what happens? 10% new moms, right, and 13% those who are giving birth are suffering from some kind of depression or anxiety disorders. They are not able to hold that much pressure, that much stress. So आपने सुना ही होगा postpartum depression. So that is a part of maternal psychology. Anxiety. Women are more prone to anxiety as compared to men, same as in the category of abuse. Abuse यहाँ पे physical, it can be physical, it can be sexual, it can be like psychological, और जिसको आप mental भी बोलते हो, social. So it is of 4 types, right? So these are the various problems of women. Next, we will cover psychology of sick persons. Like as you are in a nursing profession, sometimes you have to like meet up with those patients who are in chronic illness or who are in those condition in which is not curable at all. So what's the psychology of those persons and how you can deal with it? First one of inferiority complex. When you become dependent on someone, right? So this time inferiority comes in that sick persons because they are if depending upon the type of sickness they are suffering from, if they are totally dependent or partial dependent and whatever their condition, so sometimes they develop inferiority. I am not like others. Anxiety, fear and phobias. People who are suffering from any kind of illness develop certain kind of anxiety, fear and phobias. Like those who are not able to walk or not able to like properly move their legs, they are like very feared of like walking without some kind of support, and they will develop certain phobias for their health as well. Poor self confidence. They have a poor self image towards herself or himself, that we are now I'm dependent, now I'm not capable of doing anything. So they will start creating a poor self confidence. And next, distorted self image. They have a distorted, vague and not a clear picture of regarding their own self. Dependence. If someone is suffering from any kind of sickness or any kind of illness, it's very obvious that they are dependent on someone. Depression due to some kind of chronic illness. Some people will like develop depression. Stigma and discrimination. So sometimes they will develop some kind of stigmas and some kind of discrimination on the basis of the activities that they are not able to perform. Chronic and long exposure to illness can make them feel aggressive, or they like show aggression in some or other way. So this is the psychology of sick persons. Next one is psychology of caregiver. Who is caregiver? Who is like giving care to the patient? Denial. Sometimes what happened, the caregiver starting to refuse that this can't happen with my person or with my loved one. They start doing this kind of things. Next, you have mostly observed in like hospital setting, they start like blaming the other ones, the staff, that you didn't put proper care, this is your mistake, this and that. So they start blaming others. Next one is displacement. So they can't do anything with the person who is already sick. So they like displacing their anger onto the other person. They will also develop aggression, anxiety and depression. They will start blaming that these things are happened because of me. Somewhere I am lacking, somewhere due to my mistakes I am not able to like provide particular thing. So they will develop aggression, anxiety and depression. So this is a like stages that is given by Kubler and Ross. This is a like grief cycle, ki how grief cycle goes. So it has 5 stages: 1, 2, 3, 4 and 5. First one is denial. Denial is refuse to accept reality. वो मानने से ही मना कर देते हैं कि does this thing is happened with their loved ones. उसके बाद they will start like reacting in anger, frustration, उनको बहुत गुस्सा भी आता है. बार्गेनिंग में वो लोग क्या करते हैं कि जैसे कि आपने सुना होगा, भगवान अगर आप इसको ठीक कर दोगे आपको मैं 11 रुपए का प्रसाद चढ़ाऊंगा, 51 रुपए का, और आई विल पे यू इन दिस और अदर वे. दैट इज बार्गेनिंग, right? Depression. So they will start accepting, and on the other hand they will also develop some depression, helplessness, and hostility towards what has happened with them. Last one is acceptance. When they like accept the situation, they explore, they will start adapting to the situation and moving on with like a positive thing. So that is the last stage. It doesn't happen same with the everyone, that everyone like goes through all these 5 stages. Someone can like move from denial to the directly acceptance. Someone can like stick to the like third one. Someone can like reach to the second one. So these are particularly defined, like it goes on like this. But it is not mentioned here that ki all the individuals will go through these all 5 stages. Sometimes ki denial के बाद हम सीधा accept भी कर लेते हैं कि yes अब तो ये हो गया है, this has happened, now I have to accept it because I have to see my children's as well. There are certain other responsibilities. So unke paas there is no other way without accepting. So now we will see what is the role of nurse. So they should develop specialized program for best suited problem of these kind of populations. So we should train all the mental health practitioners to be culturally competent by recognizing their responsibilities, right? Encouraging all schools to include content pertaining to sexual orientation, gender, socioeconomic status, and physical disability. And they should also build systems that recognize and incorporate practice and value cultural diversity. So with this, we are done with our unit 4, that is developmental psychology. So development refers to physiological, behavioral, cognitive, and social changes that occur throughout human life, right? So with this you are able to like learn what is developmental psychology, the lifespan development of various stages, right? You can assess yourself with the help of this slide. So thank you so much for like watching our videos. Thank you.